Welcome back to the Arise interview, where we speak to the newsmakers as well as ordinary people doing extraordinary things around the world and featuring the voices at the heart of the stories. I'm Charles Aniagolu. Now let's leap from movie making to the coronavirus. It's been exactly 6 months since Nigeria recorded the first case of the virus, and both the government and many Nigerians have been trying to rise to the occasion of combating the pandemic. One of the isolation and treatment centers that's up there with the best of them is the THISDAY Dome, donated to the government for the treatment of COVID-19. Well, let's take a look at what's been happening so far in terms of combating the pandemic in Nigeria. Joining us to talk more about the experience in the field is Professor Sylvanus Okogbenin, who is an infectious disease expert and the Chief Medical Director of the Irua Specialist Hospital in Edo State. He's also the Medical Superintendent at the THISDAY Dome, which is, of course, as I said, an isolation and treatment center here in Abuja. Thank you very much indeed for joining us.
Thank you, my pleasure.
Well, you don't look battle-hardened.
Well, there's a lot of work on the ground.
Are you worried? I mean, you're in the front line. You deal with people with this infection every day. How much does that concern you on a personal level?
Well, to some extent, yes. It's possible that as a frontliner you can contact and be infected with the virus. But the good thing is that if you use the personal protective equipment and you follow the IPC measures, the chances are very much reduced. And that's why we're trying to ensure that every healthcare worker has the personal protective equipment that he needs, and then we keep doing training and retraining on infection prevention and control measures all over the country.
And has there been any issue like that of a health worker working with you being infected?
Well, at the Dome, no.
Well, that's good news.
Yeah, well, that's good. But you know, the Dome is really well structured,
right?
To follow IPC procedures from the entrance to the exit, the procedures that we maintain there. Really standard, and that helps a lot. And then the health workers are pretty well trained in IPC measures, and so we're able to minimize the chances that they can get infected. We're happy to say till date, none of the health workers working in THISDAY Dome Isolation Center has been infected. So
here we are 6 months down the road. Overall, how would you say Nigeria is faring today, several months after the arrival of COVID-19?
I think we really need to praise the effort that Nigeria has put into the fight of this COVID-19 pandemic. If you look at the different pillars that have been organized, from the surveillance pillar, the risk communication pillar, logistic pillar, case management, the laboratory pillars, down to coordination, I think we've done a good job in this country in the management of COVID-19 pandemic. And that's why we've received a lot of commendation from many of our partners, both nationally and internationally, about the work that's been done in Nigeria. And that's why the mortality really in Nigeria is not as high as you see in many other countries in the world. From the PTF level to the Federal Ministry of Health, the NCDC, to the tertiary hospitals and the isolation centers, I think a lot of good work has been done there, and that's why we're getting the results that we're getting.
Well, I mean, you talk about the response or the reaction, the commendation from your international partners and so on, but at the same time, I mean, we're in the news business, that there is this persistent feeling in the international community that there's a lot more COVID cases in Africa than we're actually seeing, and that the problem is that you're not doing as many tests as there ought to be in this country and across the continent, and that's why we're not seeing that many.
You should see where we're coming from. At the beginning of the COVID-19 pandemic, there were just 3 centers who could do the laboratory confirmation: in Lagos, in Abuja, and the Irua Specialist Teaching Hospital. But today, we're talking about well over 50 laboratories have come into Nigeria for this, for the diagnosis. And you know, the diagnosis is PCR, polymerase chain reaction based. And that just gives you almost 100% accuracy about the test. And it's important we follow the science. It's important that when we make a diagnosis, it is accurate. And I think that's what NCDC and the Federal Ministry of Health has done for the country. They've ensured that we can make a lot more diagnoses than was ever possible. From 3 to over 50, I think that's good for us.
No, that's good in terms of the numbers of testing places compared to what you had at the outset. But it's not good given that Nigeria has a population of 200 million people.
And that's why I said, look at where we're coming from.
Right.
We're coming from a place where PCR was not commonplace. Very few institutions could do PCR. But now, we can do it in every state in the country. In fact, the capacity of tests we can do has not been maximized. We can do a lot more testing than we are doing now. So that's why we encourage more people to come out for testing so that we can catch up and fill up the capacity that we have. So yes, we can probably do a lot more tests. If you listen to the news, even in the United States of America, where they do about over 1 billion tests a day, they're saying we still don't have enough testing. So will testing ever be enough? I think the point really is to keep increasing the number of testing that you are doing, and where you have where you're using your maximum capacity, then you keep increasing. But we haven't even used a maximum capacity. And I think if you look at it tangentially, we have made a lot of improvement from where we're coming from. That needs to be commended.
Well, I mean, we are obviously on the outside, thankfully. Most Nigerians are on the outside looking in. All they hear is this terrible disease that is, ravaging countries, affecting the economies, affecting their livelihoods. So everyone is indirectly affected, if not directly. What's it like for you? I mean, take us into the THISDAY Dome. What's it like for you on a daily basis as you walk in there and have to deal with people who are COVID positive?
This is both on a personal level,
yes,
and on the level of working.
I mean, let's see it through your eyes.
For me, I've always wanted to be a doctor, and I am one today. I may not see another pandemic of this nature in my lifetime.
So perversely, it's an amazing period for you. Really.
Well, therefore, I have to do all I can to do the best I can to justify being a doctor. It will give me personal contentment to have intervened and be part of the front line to bring COVID-19 down. I'm doing that. That's the joy of working. There's always also the sort of fear that you can contact the virus, so you take all necessary precautions, and that's that. It's interesting to know that in the last 6 months, management has continued to improve. Therefore, mortality has been decreasing in Nigeria and indeed in many countries. That's good news for you also if you're in the front line. There's some treatment modalities that have increased our arsenal to fight the COVID-19. Now we can use steroids like dexamethasone. We have good supply of oxygen, which is important. We can use anticoagulants, which are helping. We have some drugs that are really helping to make sure that our patients are doing better. And as the patients recover, you feel very happy. In the last 1 month, we've managed over 200 and something cases in the dome. We've discharged over 150. I think we have about 50-something patients in the ward now, some from mild, moderate, severe. And we're happy as our patients are recovering. And it's good to know that we've not lost a patient in the dome.
And I think you mentioned this, but just to be clear, what's the rate of recovery that you're seeing out of the number of patients that you've actually taken in?
For now, everyone has recovered.
Right, so no fatalities.
In the dome for now.
Well, that's remarkable.
Yeah, we're happy to do that.
Right, but then you've only taken 200. And of course, 200. Nigeria has tens of thousands of cases right now. So that's a drop in the bucket, isn't it?
Well, yes, but even in Nigeria, it's better today than at the beginning. And it's like that for every epidemic. Once it starts, that's when you get the highest mortality. As the doctors begin to master exactly what type of infection it is, what works here, what is the science saying, and the preparedness continues to improve, then you see that mortality begins to go down and survival improves. That's what we are seeing worldwide. The cases may be increasing in some places, but mortality is actually...
But let me ask you this. Is there something, because I mean, to be honest, what you've just told us is a remarkable piece of good news, that you have a 100% recovery rate from the people who've come into the THISDAY Dome. I mean, is there something that you're doing that other centers aren't doing in Nigeria? Or is it just purely coincidence that the type of people who are coming to you are people who have less of the underlying problems that lead to fatalities?
I think it's a combination of many things.
Right.
Maybe we're getting better patients than some others. But I think the workforce in the dome is also very efficient. I brought a team with me from the Uro Specialist Teaching Hospital. We're managing the dome. We have consultant specialists who are with us. We have specialist nurses. These are people who have been working in infectious disease. Some of them were in the Ebola fight in 2014. They were in Sierra Leone. They were the Nigerians in Sierra Leone. They manage Lassa fever on a yearly basis. So pretty, very...
very capable, very competent.
Yeah, very competent. People. That's also part of it. And maybe the cases we're also getting are not very bad, but we've seen many that have desaturated. And then with therapy, they begin to, their oxygen saturation improves. And then it's a holistic care. Many of our patients have comorbidities. And then we make sure that we also manage that along with this. And I think the supervision, they know I'm there every day to calm down on those who are very ill.
And is there also a rate of, I mean, I've heard it said that there is an element of reinfection. I don't know if that's the right medical term, but certainly that there is an element of recurrence. That sometimes people go, they come back, and then, you know, a few weeks later, it starts to afflict them again.
I saw on the news yesterday about someone who, somewhere outside, I can't remember whether Asia or where, someone who's gotten the infection, and 4 months later, so they think, is this a reinfection? I think it's still early in the pandemic to see whether we can see a reinfection. I know we've seen a patient who had an infection, got better, became ill about a month later. We're not sure whether it's a persistent infection or a reinfection, you know. So I think with time, science will help us really decide what exactly it is. But everybody's keeping a close eye on it to see whether it's possible to get reinfected.
Okay, I'm going to ask you to stay with us. I really am enjoying talking with you because, I mean, you're giving us some insight into the things that we wouldn't normally see. So please stay with us. You're watching the Arise interview. Plenty more still ahead as we continue our chat with Professor Sylvanus Okogbenin. Stay with us. Welcome to the Arise interview. I'm Charles Aniagolu, and with me in the studio, Professor Sylvanus Okogbenin, who is an infectious disease expert and the Medical Superintendent at the THISDAY Dome Isolation and Treatment Center here in Abuja. And we are talking, of course, about the coronavirus in Nigeria. Thank you ever so much for staying with us.
Thank you very much.
Now, you and I were having a jolly good chat during the break. And what I want to talk about before we get to what we were discussing during that break is that Nigeria, I mean, you talked before we went on a break about the fact that the fatality rate is coming down. That suggests that Nigeria has reached a peak, does it? In terms of mortality.
Well, yeah, in terms of mortality, it's coming down. I don't expect the mortality rate
to go up. Right.
I do expect that as science continues, there will be more drugs, more procedures that can make mortality better. Yeah, we do hope to see that. We know that in many countries around the world, They're looking for vaccines. Vaccines trials are going on, drug trials are going on. I think as the results begin to pour in, then we can also benefit from some of these trials.
But what do you attribute? And again, take it from someone who is, who really, I mean, I'm not a doctor, and I don't know, so I'm asking the questions that the ordinary person on the street probably would ask you. What is it that's making this recovery possible? Not just at THISDAY Dome, but across Nigeria? Because, I mean, from what we understand, there's no clear medical, or rather medicine, that is, it said 100% this, you got a cold, drink this, you know what I mean? You got a headache, drink, Panadol. I mean, how do you treat it and ensure that there is some form of recovery? Is it still experimental to a large extent?
Well, first of all, majority of the people who have COVID will be asymptomatic or have mild disease.
Right, okay. So the symptoms are mild.
Right. So over 90% may probably recover without much medical drugs.
Right.
But then there's another 10% that will develop moderate to severe symptoms, and another 5% will develop critical symptoms. These are the ones that we're really worried about. Now, there are things that work that improve mortality. Remember, the cause of mortality in these patients are, one, could be a respiratory failure when the lungs can no longer take in oxygen. Sometimes it could be a renal failure when the kidneys shut down. And sometimes it could be bleeding problems. Now, what you do is monitor all this, particularly with the respiratory failure and the lungs no longer taking oxygen. As a viral infection, many of the times, many viral infections would live their lifespan and go without causing much damage. But if they are causing damages, then you must attend to them. If a patient is desaturating and you can give oxygen, the steroids will also help the lungs. Sometimes you may need to use bronchodilators. Sometimes you may need to use local steroids, inhalation. And sometimes you may also need to give anticoagulants. And sometimes you may also need to do dialysis for the patient's kidneys to pick up. I know that at ERA we have done about 5 dialysis for some patients, and 4 of them have recovered, but 1 succumbed. If you had not done that dialysis, then the patient would have died of COVID, but it's a renal failure, not a respiratory failure. And sometimes you may need a ventilator, but we're beginning to realize that ventilators are probably not as important as we earlier thought. Giving high flow oxygen and using ventilator in very few select cases is the way to go.
Now, in terms of the science, because you're obviously in the front line and you've got scientists doing the work, what is your appraisal of how it's going? There's all this talk, Donald Trump going on about plasma and, as a way of treating COVID-19. You've also got, as you mentioned, a lot of companies doing research into vaccines. What is your sense of how that is going, and whether or not we're going to be living with COVID-19, for at least the next 2 years or so, which is the normal time span for sort of a vaccine to go from trial to usage?
I think COVID will be with us for some time. The scientists are saying vaccines will come out by the end of the year, first quarter of next year. It will take a while before these vaccines can go around the world, and in that space we will have to be battling with the COVID. The vaccines can be a major asset to the fight against COVID-19, but it's good for it to have undergone all the proper trials. It needs to go through animal trials, phase 1 human trials, which just tells you this is a safe vaccine. It needs to go through phase 2 trials, which shows that this vaccine can produce the immune antibodies that are needed, immunogenic. And then it has to go through phase 3, where you try it with a large number of people to say, yes, it is efficacious. So vaccines need to go through all these trials before it is safe, it is efficacious, it is effective.
Okay, given what you've just said, you know that the Russians announced a week or so ago, recently, that they had come up with a definitive vaccine. You heard about that,
Yes.
I presume. I mean, what is your sense? A country like Nigeria, for example,
Yeah.
I mean, you know, with the United States and Europe and all that, there could be a political element
Yeah.
to it. Yeah. But for a country like Nigeria that is non-aligned, I mean, technically, and tries not to get into the politics of this, I mean, what is your reaction to that? Is that something Nigeria would say to Russia, hey, you know, give us this stuff, let's give it a shot?
There are two ways to look at it. First of all, we are aligned with the WHO.
Right.
So we will.
So there are protocols.
Yeah, there are protocols.
Right.
With WHO. I would want a vaccine that has gone through the 3 phases of human trials.
So you're not satisfied with what the
phase
Russians have
no,
done?
If you say you've not gone through phase 3 trials, I'll be glad to go through phase 3 trials.
Right.
Because that's how you know that it's safe and its efficacy. It's you're going to try it, and you don't want to go halfway, and then you ask yourself.
And whoops.
Yeah. The chances that we'll get some good vaccines, but then we have to follow the protocol. That's my honest personal opinion.
Right. And what's the reaction at the WHO at the moment to that vaccine? I mean, what's your sense of whether or not they're encouraged by it or saying, hey, let's not touch this? Because, I mean, the Americans are already politicizing it. And,
well,
you know, you don't want to cross Donald Trump, do you? Especially after what he's gone through with the WHO.
Well, I think WHO will be really careful. They have this COVAX issues they're discussing, which are vaccines for COVID, and there are many candidate vaccines that they're working on, and I think they will want to see the evidence of good clinical trials. And you know, when you bring them the proposals to ethics committee wants to review the preclinical, the animal data. It wants to review the phase 1 trials. It wants to review the phase 2 trials. It wants to review the phase 3 trials before it can make any pronouncement. If you're not giving us the results of those trials, it becomes really difficult.
Absolutely.
Yeah,
and rather suspect.
It becomes difficult. I think those are the issues.
Okay, we've got about a minute before we have to end the program. What's your final word, your definitive final word on the state of COVID-19 in Nigeria? What would you say to Nigerians who are watching right now?
I think the message is simple. COVID-19 is real. We have to do the things that science has told us to do. That's what PTF is saying every time. You have to wash your hands frequently. You have to use a face mask frequently. You have to keep the social distance as much as possible. If you notice any symptoms, go for a test. If it's positive, go for isolation and treatment.
Okay.
The chances becomes very good.
Well, Professor Sylvanus Okogbenin, I want to thank you very much indeed for coming in. And Professor Okogbenin is an infectious disease expert and Chief Medical Director at Irua Specialist Hospital in Edo State. He's also the Medical Superintendent at the THISDAY Dome Isolation and Treatment Center in Abuja. That's it for this edition of the Arise interview. Do join us again tomorrow from me and the entire team here in Abuja and Lagos. Bye-bye, and thank you for watching.